The minister notes that the language spoken in the clip appears to be an indigenous Namibian language from the northern regions. The ministry is now calling on the public to assist in identifying the location and the individuals involved. Dr. Kantema says, should it be confirmed that the incident took place in Namibia, the ministry will immediately activate child protection mechanisms.
It's a ministry that is entrusted with a mandate to promote the safety and the well-being of the children. We are administering an act, that's our legal framework, that guides our operations, the Child Care and Protection Act, Act number 3 of 2015. Now, in terms of the act is very clear in terms of what should happen when a child is found to be in need of protection service. If it's established that the incident has occurred in Namibia, obviously the ministry, we are being proactive. We will immediately activate child protection mechanisms in line with the act that I've just mentioned, because it will then include measures such as welfare and safety assessment by our social workers, engaging the caregivers, and where necessary involving law enforcement and social workers to ensure the child is protected and that the child receives the appropriate support services that we render as a ministry, where we are ensuring that where a child is in need of a temporary shelter, that measures is then provided to a child.
These measures include welfare and safety assessments by social workers, engaging caregivers, and where necessary, involving law enforcement to ensure the child is protected and receives appropriate support services. The ministry has also condemned the recording and sharing of such videos, warning that it causes further psychological harm to the child and exposes them to stigma and long-term trauma. Instead, the public is urged to report such incidences.
It's urging the public, individuals who are recording and sharing these videos to really refrain from doing such, because it's also damaging to the child. Imagine the traumatic experience that the child goes through, and also in terms of the psychological harm that it may cause, where the child can then face ridicule, and this may lead to long-term psychological trauma. It can lead to stigma. Therefore, the focus should always be on protecting the child, not amplifying the harm through sharing of such image.
The minister called on parents, caregivers, and communities to take collective responsibility for the protection of children, warning that alcohol exposure in early childhood has serious long-term effects on brain development and overall well-being.